We have placed an order for 100,000 vaccines, influenza vaccines for this year. We have received the first 50,000 from PAHO, and we're expecting a tranche of 50,000 again.
Chief Medical Officer Dr. Roshan Parasram is urging the population to get vaccinated for influenza, which can keep people from getting sick or reducing the severity of the disease. He reminds that there have been deaths recorded due to the flu in the past. Dr. Parasram says up to around mid-October last year, there were 830 suspected cases of influenza with no deaths recorded, while there have been 115 suspected cases for this year so far. He adds that suspected cases of the flu could also be tested for COVID-19.
The same sample that we take for COVID-19, which is a nasopharyngeal swab, we also take to identify influenza. Severe acute respiratory illnesses, we take that sample and we test for both things. So we can also tell with that sampling technique if you have influenza or you have COVID.
Dr. Parasram says there is still capacity to do additional tests should there be a surge of people presenting with symptoms.
The country can do anywhere between 11 and 1,200 cases per day in terms of testing. We're doing about 600 to 800 at this point in time. So we have some reserve capacity.
The CMO says the main target for this vaccine would be children, adults over 65, people suffering from NCDs, the pregnant population and healthcare workers. He also has some advice as to how long someone should wait to get the flu vaccine after taking the COVID-19 vaccine.
When you have your second dose of a 2-dose regime, you wait at least 2 weeks before you have your influenza vaccine and vice versa.
The CMO assures that there is sufficient stock of Tamiflu, which is used to treat the influenza illness. Sunil Lalla, TTT News.